Nasal rinsing is an ancient Hindu practice that many providers recommend to keep your nose clean and moist, or to get important medications deep inside your nose and sinuses to those places that a nasal spray may not reach. Rinsing can wash away particles that worsen allergies, and it is especially important to do after most nasal surgeries. Before he prepares his sinus rinse, Jose thoroughly washes his hands. Next, Jose pours in just enough water to reach the black line. The water should be either distilled water or tap water that has been boiled first, then cooled to room temperature. If it is too hot or too cold, the rinses can be uncomfortable. He adds either a pre-made salt packet from NeilMed or a 1/4 or 1/2 teaspoon of pickling or canning salt. The right amount of salt prevents the rinses from drying out your nose. Rinsing your sinuses should feel soothing and not burn the inside of your nose. It is at this point that Jose adds any medications that he may need to mix into the rinse, if prescribed by his provider. Finally, he shakes the bottle to make sure that the ingredients are well mixed. Now Jose is ready to rinse. He angles his head and inserts the nozzle of the rinse bottle into one nostril and squeezes. While he rinses, Jose breathes through his mouth and says, "K." Saying K while rinsing helps close the ear tubes in the back of Jose's oral cavity to prevent the water from backing up into his ears. This also helps him to breathe out while rinsing so he doesn't accidentally inhale a little rinse water. Some people who have just had nasal surgery might not be able to get the water to run out at first, which is normal. They should keep rinsing anyway, to clean out some of the debris in their nose. Have a clean towel handy, you might need it. And if you feel like you need to sneeze or cough, stop rinsing until the feeling passes. And don't try to talk or swallow while you're rinsing, because doing this could cause fluid backup in your ears or even an ear infection, and we don't want that. Here are some basic do's and don'ts of nasal rinsing. Do wash your hands prior to setting up. Do use distilled or boiled tap water. Do add additional medication if instructed by your doctor. Do say K while rinsing if you feel water backing up into your ears. Do clean your bottle after every rinse. Don't use tap water out of the sink without boiling it first. Don't use water that is too hot or too cold. Don't add medications to your rinse if you weren't instructed to do so. Don't reuse a bottle if you haven't cleaned it yet. Don't share a nasal rinse bottle with others. Next, we need to clean the bottle. Put a few drops of baby shampoo in to rinse the bottle along with some boiled water and shake the solution. Then, empty the soapy water and scrub the inside of the bottle with a bottle brush. Rinse the bottle out. Shake out the excess water and pop it in the microwave for about 90 seconds to sterilize it. That's what the manufacturers recommend, though there haven't been any new studies yet to confirm if this is truly necessary. If you are a patient at UCSF Otolaryngology and you have further questions about your sinus irrigations, send your provider a message in the MyChart portal or call us directly at 415-353-2148 and one of the nurses will get back to you.